Share. Nobody. Quality. Okay, guys. Good afternoon. A little improvised today. Thank you for your patience with postponing the classes to this time. So let's go. Just to review, I want to review what we did last week. We actually did 3 lectures last week. So we started off with the public health approach. We defined public health. We looked at concise definitions of public health, and we spoke about it being a social institution, a discipline, and a practice. We mentioned that public health is a science and an art of preventing disease, prolonging life. We looked at the essential public health functions, which is monitoring health status to identify problems, informing, educate, empower, mobilizing community partnerships, very important, developing policies, enforcing laws, linking the needed personnel to the required health services to ensure that you get good provision of health care where it is otherwise unavailable, ensuring effectiveness, access, and I mentioned the word access being of huge importance in public health, and you would also you'll also see and appreciate the word access when it with regards to primary healthcare, and we're going to do primary healthcare later on today. So we defined. So how do we take a public health approach to that problem? And I want you all to keep in mind coronavirus that has affected the world. You all are lucky to be experienced. Well, not lucky, but you all are in a time where public health approach is real, is definitely being applied all over the world. You look at the responses of the different countries. I know there are lots of comparisons on the internet that compare what we would have considered some of the more that compared the approaches made by the developing countries and how successful they were as compared to the actual developed countries. So you all are in a period that you can learn a lot from. So define the problem, identify risk factors, develop and test community level interventions, monitor those interventions, implement and monitor those interventions, and make a feedback loop. We talk about systems theories since in Monday's class as well as in community management. Systems theory, inputs, processes, outputs, feedback loop. We looked at a nice little diagram that shows a stepwise approach. This was on slide number 17 on public health. What is the problem? Identify the problem. Identify what is the cause of the problem. Make a possible intervention or put forward a possible solution of what could work and implement how it could work. Now, I want to share from a professional standpoint what you would see the US in particular being a large country that had a similar issue, but I also had an issue with the World Health Organization and even our own country not putting forward solutions that might work. There was a lot of caution that was applied to coronavirus and COVID-19, as it was later called. Yes, because as scientists, we want to use evidence-based medicine. But we were in a pandemic of something new. And there were lots of hesitation. And I'm sure you all could, if we go back to the months of March, we go back to the months of February, March, April, you will see interventions not happening in a timely manner. Something as simple, and let me ask the group, if you all can remember that the wearing of masks. When did the wearing of masks become important? When did the wearing of masks become a necessity? It's actually quite later on. The US is actually now adopting the mask policy, something that China, Taiwan, Singapore, most of the Asian countries that were familiar with pandemics and epidemics, not pandemics, epidemics, they knew the role that a mask has to play in preventing transmission of these droplets, as well as they are now accepting it, aerosol formation from persons who speak, persons who cough, persons who laugh, persons who speak loudly, aerosols form. So I'm using this as a real direct example to show where, from a public health perspective, the WHO was lacking. Our own local intervention was lacking in that for weeks, for months, there was no defined statement on wearing masks as a preventative measure. And as a result, I would consider ourselves lucky. We are lucky in TNT. Our death rate started off high, pretty high relative to other more successful countries, but we've gotten it down. And I consider ourselves lucky because because of the density of our population as compared to other Caribbean countries, we could have found ourselves in problems. And I'm not saying that we won't find ourselves in problems in the future. We actually can still find ourselves in problems. However, I'm trying to emphasize on that point, on making a public health intervention. What works? What works? What works in other parts of the world who experience these things, they use their mask and it helps to prevent transmission. So given a given an intervention that you hope will work, and based on, we can say it's anecdotal, but based on not it being pure evidence based, pure research based as yet, but we based on our ability to apply our knowledge. And I ask you as students as well to always apply your knowledge to solve a problem. Always apply your knowledge to solve a problem. Don't hide behind academia when you are called in the time of crisis. So this coronavirus, COVID-19, was a time for crisis management, and that's all of you in that class on Monday. And it was about using a public health approach of what worked in other countries that could be easily replicated here. So continuing on with the review, so implementation of what works and how do you do it? So the public health approach: what, where, when, who, how. Collect your data, analyze your data, define the problem. Is your issue preventable or not preventable? Is it controllable or not controllable? What is the level of its priority? And again, you all have a literature review of the impact of coronavirus on the economy and on the management of institutions and business. Do your research. The information is out there. And we needed to get a plan, a champion, strategy, method, will, and funding. And the will, the will that we speak about, this will be my fourth or fifth time, is the political will or your management will. And simply do it. Review what worked and what didn't work. And then we spoke about the drowning in Arizona. So that was your public health lecture from last day. And we are going to review the other lecture we did, which was, we looked at health ICT, and we introduced terms such as equity, equality. Hope you all remember this. The very first diagram that compared equality, equity, and reality and liberation. And I know we spoke about healthcare, especially in public healthcare where resources are scarce. You would want to spend your resources on persons who need it the most, and request of persons who would not need it to not utilize the service, so that your funding would reach the people who actually need it. We talk about health threats and epidemics and pandemics deteriorating healthcare facilities, all being health threats. Problems that we face with personnel simply not being available in a particular location, in rural locations, in very far locations. Declining resources, competition amongst different arms of government for resources, health funding in particular, and how information communication technology can help with that. And I gave you all an example. Let me see how much of you remember what is the example. 150 pennies. Yes, Vasudeva, I saw that, and it is a concern. It has been a concern from even before coronavirus. And I don't know if I gave you all the example, but 2 years ago, there was a red eye outbreak in Venezuela. You were finding more and more Venezuelans coming to community pharmacies asking for terramycin, which of course is a prescription drug. And some of them will get the prescriptions to get it. And soon after, there was a red eye outbreak in Trinidad and Tobago. That's the event, that's the reality that we have to face, that when we have open porous borders, as Vasudeva said, they come in, these people are living in a desperate situation, and I empathize with them. We should all empathize with them. However, we need to ensure that our country is protected while we try to assist people who are in need. We need to protect ourselves first. So thanks for bringing that up, Vasudeva. But I was about to make the point. Let me just get back to it here. Right. I was about to ask you guys, in what field of medicine has this already been applied? Let me get some answers. Let me see who's in this class today so I can call out some names. All right, Caleb is supposed to be in class. Mel, Celine, who else? I'm just seeing M, Darian, Tia, Salvage, Precious. Precious, I didn't see you yesterday in that class. So Precious, Cheyenne, all of you. Give me somebody. Oh, Precious, you're on point. Very good. Radiology. I love it. Radiology. Radiology has been, thank you very much, Precious. Radiology has been used in Trinidad, um, in some private institutions, and especially in the US as well, where it is difficult to get the radiologists available to make the report. They take out their scan. It's an electronic copy. It's sent to a country where radiologists perhaps are bound, or to a country where it's a company that does radiological reporting. And there we go. So it helps to provide fast, efficient, and cheap access to medical care. And it helps to have better decision making. We spoke about, yes, improving decision making, promoting self care. So ICT applications would be the EMR, the electronic medical record. We would like to be in that position. I think I mentioned to you guys that almost 10 years ago, or sorry, more than 10 years ago, the government of the day, we were close to getting to the electronic medical record to get all health institutions connected, at least public institutions in the initial phase. It fell apart. So we have, the only thing that connects us right now is the Selma system, which is which is used in some health centers and some hospitals, but it's used in all of the private pharmacies for the purpose of the CDAP application. So ICT applications would include telemedicine, community health as well. It helps, ICT applications help with cost, quality, accessibility, and delivery. ICT would help to bridge the gap of rural neglect. You can't go and provide services in very far distant areas regularly, but once you can get the infrastructure there that can allow persons to have access to health information and health services through ICT. And we started to talk about primary healthcare in ICT as well, but we have an entire lecture on primary healthcare to do. So we'll do that later today. Right, so ICT's application in healthcare is not just an electronic medical record. It's more than that. There are much more things that can be done by applying information communications technology to health. Right, so there were some distinct advantages, as you can see in the very last slide. So that's a review of ICT. And reviewing the next lecture we did was how is healthcare funded? Right, and we used the University of Birmingham slides, and we spoke about funding of healthcare. We talk about national healthcare system, social healthcare system, the Bismarckian system. We spoke about voluntary private health insurance, and we spoke about community-based health insurance. All of those are funding mechanisms for healthcare. Things that ought to be controlled in healthcare, in the healthcare market: consumer moral hazard, adverse selection, provider moral hazard, and we explain these. Right, so that was the review of those 3 lectures that we did last week. So this week, what is remaining for us to do is human resources in public health, primary healthcare, quality improvement in healthcare, and self-management support system. So today we'll do human resources in health, in human resource issues in public healthcare. And if you remember, from our classes on Monday, your human resource is the absolute most important human resource. Your human resource is the absolute most important resource in your organization, especially when it comes to a human interaction with another human interaction, as it is in health. So there would be some issues. So let's go through them. So in this lecture, it has special reference to employee and patient satisfaction, not necessarily focusing on the actual healthcare worker itself, but the outcomes of the patient. Sorry, mix up my words here. We're looking at both employee and patient satisfaction. So here we go. Second slide, you see input, human resources as the processes and the outcome. This is an excellent slide to help summarize what we do in healthcare. Your input would be your health systems, your equipment, technology, your drugs. There are so many things that go into input. And your processes, your healthcare employees and your patients go through processes, your clinics, your surgeries, your monitoring, and your outcome being the patient's well-being. And now we have in most leading healthcare societies, we refer to the patient, but we no longer refer to the person as a patient, but we refer to them as a customer. And referring to them as a customer connotates greater responsibility to the patient, or formerly patient, to the person, with respect to making sure that they are satisfied. All right. In one of my previous jobs as a manager of a hospital, I remember we hired a human resource person that came from the aviation industry. And we did that because we wanted to ensure that the quality of satisfaction that is found in the aviation industry when you fly, you feel, no matter if it's Liat, Caribbean Airlines, whoever it is, the airline industry has a certain standard when it comes to patient satisfaction, customer satisfaction. I myself using the old term. So we benchmarked ourselves and we looked at getting the expertise from the airline industry, and we'll see that later down in other lectures. So your healthcare customers, as rightfully said, are your external customers, which would be the patients who are sick, who come in, the persons who come in who are ill and who want your assistance, your professional assistance. And then your customers are your internal employees. This is applicable not only in public healthcare management, it's also applicable in any type of organization and business. You have your internal customers and you have your external customers. Your internal customers are always your employees, the people who utilize your service as well. And your external customers are those who are not within your organization that utilize your service. Okay? Patient satisfaction, employee satisfaction, organizational success. When your patients are satisfied, your employees are satisfied, organizational success. And those of you who would have been there in yesterday's class, we did a lecture that actually speaks to this as well. We did a lecture yesterday that speaks about employee satisfaction, patient satisfaction, producing organizational success. Who can tell me what that lecture was about? Who can tell me? Calling out for Caleb, calling out for, let me see who else is here. Celine, well, I haven't heard from Celine. Tia, if you all were in class yesterday in community, tell me what was the management tool that we used And we spoke about that sounds very similar to this. I'm waiting on the answers while I continue. So, patient satisfaction, the areas that we look at would be the department level, the emergency room. All patients or customers, external customers, they all flow through the healthcare system through the emergency room or through a clinic, but generally through the emergency room. Overall hospital facilities, the physical facilities of a hospital, the location of a hospital, those things are important. I remember in our program that I did in my master's, there was an entire course on the development of facility and infrastructure that is designed to be an environment that gives the patient a healthy feeling. The visuals, where it's located, if it's on a mountain top, if it's near to a lake, believe it or not, those things are actually very, very important in healthy patients. And I want to get the thank you very much, Matthew. Very good. Balance scorecard. Balance scorecard is exactly that, and I will share with you guys from institutional what we spoke about. Balance scorecard. BCG, no Phar, not BCG Matrix. BCG Matrix is about a strategic business unit, a product. Matthew was correct. Balance scorecard is where you look at your organization and you develop strategies based on learning and growth, which is your employees. Yes, Firaz, that's okay. Your employees always learning and growing. That feeds into efficient processes. That feeds into customer satisfaction. That feeds into increased revenues, better organizational management. All right. So I'm sharing that with you from yesterday. The balance scorecard. It's something that maybe some of your colleagues can share it with you. For those of you who are not in community, it's a very, very good tool in managing your organization. And don't think for one moment that because you are doing public health or institutional health management, that you would not be managing an institution that is for profit. And even if you are managing an institution that's not for profit, like an RHA, I want you to understand something. At the end of the financial year, it is important to show that you are not in deficit, that you utilized your funds so efficiently that you can actually manage all of your different departments and still retain some savings. You might think, hey, it's a public health institution. We shouldn't be saving. We should be making sure that we have Panadol. We should be making sure that we have beds. However, you need to show at the end of the financial year that you utilize your money well and you are not in the hole, as we would say, for cash. You are actually able to have some money saved for contingencies, and we spoke about contingencies on Monday. All right, good. And with respect to employee healthcare satisfaction, they look at your nursing staff, your physician staff. Right, so slide number 5 is a little busy slide, but it has some good information. In the entire world, there's about 35 million persons employed in the healthcare sector. Of course, HR accounts for a high proportion of budgets assigned to the healthcare sector. Remember I said from last week, your HR is your most important resource. However, it's your most expensive resource. And that's why, as managers, you always need to know that you're getting value for money. You are investing in persons' development and their training for them to produce good results. You don't want to have persons in your company on your payroll that simply is not getting the job done. All right? And we can talk some more about that because I know I mentioned to you to not just be a commodity. Add value to your role, add value to your function. as a professional pharmacist, and as a pharmacy manager, and as a manager generally. Okay? So the fourth point is health services missions, strategic plans, and quality improvement initiatives are all useless unless there's appropriate policies for managing people. Managing people, guys and gals, managing people is going to be one of your most challenging jobs as a healthcare manager. Okay? So, healthcare, is it a science or is it an art? The perspective of science is that it's constantly achieving and delivering high quality healthcare products through the use of science and innovative technology. As an art, healthcare is about managing human beings who provide the services and improve the products. So look at it from a science and an art perspective. This is a good question for your exam for a structural or even an MCQ. So some challenges for healthcare systems: the physical infrastructure, the governance of the healthcare system, financing. Financing will always be a challenge and an issue for healthcare systems, especially those that are funded by governments and where there's universal healthcare, where there's, for one far better word, free healthcare. It's a very expensive thing, and your human resources. Insufficient human capacity on slide 8. Um, New opportunities are coming about as a result of scientific advancements, vaccines, new drugs. Without a motivated and competent, well-distributed workforce, you end up having a waste and misuse of resources. And I am sure you can think of an example. It does not have to be in health. It can be in engineering. It can be in food, where you don't have competent people, where people aren't motivated to be in your organization, and they end up wasting your resources. And that is a travesty. And that is something, as a manager, you do not want your resources being wasted. That's why companies all over the world invest heavily in their human resource. And I'll tell you something as well. You invest heavily in your human resource, and when it comes time to separate yourself from that employee, you can feel confident to know that all that could have been done was done to aid in this employee's development and to allow this employee to flourish in their role. Something to take note. Okay. Um. So we're 2 o'clock. So we're going good for time. All right. Slide 7. I don't know if these slides were okay for you guys, but I'm seeing like it isn't. Whoa. Okay, so we're looking at, my apologies. Okay, right. Dimensions of human resource and health performance. The dimensions we're looking at: coverage, productivity, technical quality, socio-cultural quality, and organizational stability. Using the workforce to guarantee the viability of services and the capacity to adapt to changing. That's the organization stability. Productivity, you're looking at a ratio of outputs relative to inputs. Productivity ratio, outputs in relation to inputs. You don't want to invest a whole lot of things into something and only get a very small output that has very small significance, that has very small amount of implications. The technical quality, the extent to which services have a positive impact on health. So some challenges of the health sector, of the human resources, of the health sector on human resources. Changes, cost reduction, improvement of performance, decentralization of services, changes in the healthcare model. And the implications for the workforce would be staff distribution, working conditions, incentive systems, deployment of personnel, methods of recruiting and retaining staff. Remember, there are some key elements of human resource: recruitment and retention, training, all part of human resource. Redefining of professional roles and integration of services. So there are some workforce imbalances that affect healthcare human resource. There are mismatching of numbers, the shortages versus surplus. You would find shortages in a certain area of a country, for example, where there would be surplus in another area. All of those are imbalances in the workforce. Qualitative disparities and an uneven distribution based on, as I said, geographies and specialties. So the characteristics of HR activities in the health sector: strong professional dominance, the role of the state as the principal employer, the main employer. There is ambiguity of the relationship between between health needs, services requirements, and finally, there are many deficiencies in the market. So some policy issues, and this is the last slide for human resource policy issues that we need to would be that face us would be the linking between effectiveness of the healthcare workforce and the improved performance of the healthcare system. The size, the composition, the skills, the training needs, adapting to the different changing priorities. You need to have your policies in place for that. Lack of data for evidence is an issue. And finally, getting the framework for assisting countries for HR planning and development. Investing in HR in some of the underdeveloped and developing countries. It's not a priority where it should be a priority. So you have more and more work coming in to get more focus and priority on human resources in healthcare. So we will take a break. We are now at 2:05. Before we do the other lecture we're going to do. Oh, sorry. Any questions? Any questions? So the next hour, we're going to be doing um, quality improvement in healthcare. We'll do quality improvement in healthcare. Any questions? No questions? All right, guys. So we'll take a break. Break. And we will return at, now it's 2:05. We'll return at 2:20. All right. So I'll see you all guys in 15 minutes.